morning, Muscatine. My name is Autumn Schultz. Before I get started, I want to say thank you to our sponsors, Hy-Vee, Unity Point Health, Trinity Muscatine, Muscatine Power and Water, Becky Insurance, Toyota of Muscatine, Rival Plumbing and Heating, Impact Fitness and Nutrition, Lutheran Living Senior Campus, Impact Life Blood Center, Harper Cycling and Fitness, Muscatine County Fair, Bayer of Muscatine, and Muscatine Walk to End Alzheimer's. An event that is happening tomorrow is the United Way of Muscatine for the Kids Vintners Dinner and Wine. That is going to be with Arden Creek, and this will be at the Merrill Hotel to support the United Way's First Kids Fund. This is $65 per person or $500 for 8. If you'd like to, the social hour starts at 5 o'clock with the dinner starting at 6 p.m. Contact United Way of Muscatine, go onto their Facebook page or their website to reserve or have any questions and get your seats today. So that is still available. So today we are going pink, and before I get started, I was telling my husband that I was wearing pink today rather than a Halloween costume, and I said, oh, I should have just gotten a Princess Peach one because it's still pink. Turns out my husband didn't know who Princess Peach was. Apparently he didn't play enough Super Mario as a kid, so my heart was a little broken this morning, but it is okay. I will forgive him, and now I'll need to find a Princess Peach picture and costume, so kind of educate him on some pop culture there. But we are going pink today for breast cancer awareness, and my guest this morning, Jamie, is here from Unity Point in Trinity Muscatine. Good morning.
Good morning.
So did you know, when I said Princess Peach, did you know who Princess?
I do know who Princess Peach is.
Okay,
yes.
So my husband needs a little pop culture.
Yes, yes.
A little pop culture reference. So tell us a little bit about what you do with Unity Point.
Sure. I'm one of the breast cancer nurse navigators at Unity Point. So I'm one of the nurses that meets with patients typically right after their initial diagnosis. Usually it's with a surgeon at Unity Point that they meet with right after they're diagnosed. So I'll meet them at that appointment and then just help coordinate their further appointments, their multidisciplinary team, assist with any other testing or diagnostic stuff that they need done, and then just kind of follow them through that journey of their treatment, meet with them before and after surgery, and then kind of help them along all the way through survivorship.
Okay, so yeah, that was my follow-up question is you're with them from beginning until...
That is it, yep. And I always kind of tell ladies I'm available for as little or as much as you need me. So some women, you know, I spend a lot more time with, where others are maybe a little more independent, and I kind of just meet with them periodically. So it just varies by patients and what their needs are.
Okay. When we talk about like the mammogram portion of it and even the self-checks, can you tell people, you know, why these are so important and why they need to be happening maybe almost yearly or annually?
Yeah, definitely annually. So mammograms and self-checks go hand in hand for screening for breast cancer. A rule of thumb we kind of tell women, it's very important to know you're normal. For doing breast self-checks at home, recognize when something is different or something is changing, and if it continues to change or get worse, sooner rather than later, to bring that to the attention of their primary care provider or whoever. And then also, even though that's very important, the majority of women diagnosed with breast cancer are just going about their business feeling just fine and having normal self-checks at home, and they go in for their screening mammogram and they get called back due to a small detection, and it's a very early breast cancer. So they're both very important to do both of these things, and as with most cancers, early detection is basically kind of helping them with a more curable, treatable, survivable breast cancer.
And what are some of the kind of symptoms or, you know, side effects that they can see when they do self-checks? What are some of those things they need to be aware of?
Any kind of change to the breast, it all goes back to knowing you're normal. So whether it's new lumps or bumps that you're feeling, there are certain types of breast cancers that have skin changes, you know, redness, swelling, any kind of nipple aversion or anything like that. So really anything out of the normal. So if you're feeling something that you don't normally feel, now once again, premenopausal women, you know, with our periods, those things can kind of wax and wane. So if you have a little lump or bump and it's around your menses and it goes away, that's probably nothing to be concerned about. It's more when you have something and it progressively changes or gets worse and is not going away.
Okay. And also, is there, in the sense of kind of weight loss, maybe just in the sense of like appetite changes, can those also take into effect?
That's not typically something with breast cancer that we would see. You're not usually having any other signs or symptoms, and honestly, the majority of the time you're having zero symptoms. Kind of back to the screening mammograms, you're feeling 100% fine, and you're just going in for a screening mammogram, and we find early breast cancer. So, breast cancer is not usually one where you're having any other kind of symptoms.
Okay. And when it comes to getting the mammograms, when should women start?
Yeah, so right now the average risk woman is advised to start their screening mammograms at age 40. With that being said, it's never too early for a woman to start kind of assessing their breast cancer risk and talking to their providers about their risk, because there are a population of women based off of maybe personal hormone history, or family history that would be advised to start screening even earlier than the age of 40. So we also have a high-risk program at Unity Point where we help evaluate women that are considered high risk, or maybe see women under the age of 40 and discuss those different factors like their family history to see if an option of earlier screening would be something recommended for them.
Okay, so it does really tie into family genetics as well.
Very much so.
Okay. And when it comes to, say, like, of course, I've never had one before. So what is kind of that first time experience to what to expect?
I think most women have in their head, a wayward stigma of how bad their mammogram is going to be, and then I would say the majority of women after their first mammogram are like, wow, that was no big deal. I wish I wouldn't have maybe waited so long, because typically we would say once you turn 40, let's get that scheduled, and a lot of women might wait until they're like almost 41 or 42 because they're putting it off thinking it's very painful. It's actually a very tolerable procedure. It could be a little uncomfortable due to the compression that the breasts are in, but that compression itself lasts less than a minute or two for each breast. So your actual mammogram is probably 10 minutes or less. The procedure and the time commitment for being there is maybe 40-45 minutes, but the mammogram itself is very quick and typically a not very painful experience.
Okay. Yeah, I would have never expected that.
Yeah.
I just, of course, in my head, I think when I hear like a mammogram, it's like an X-ray.
Yeah.
So I didn't realize that there was actually compression.
There is compression on the breast.
Okay. And so, of course, sometimes when people hear that, they get a little nervous of thinking like, oh, that's going to be high intensity,
but many people think, I don't know the medical terms to put it, but like my breasts are being smashed, that kind of thing. And it is a tight compression, but it's very short-lived, so it's a tolerable, typically not as bad as what we have on our heads.
And when it comes to these, and you recommend yearly to have this checked?
Yes, we do recommend yearly for the average risk woman, and then that kind of goes back to our high-risk program. We have a high-risk program at Unity Point, and once again, that's where we assess your family history and then your own hormone personal history. There are women there's several women that we see in our high-risk program that get annual mammograms and also additional imaging every 6 months. So they get annual mammograms. We have a screening mechanism called whole breast ultrasound, which is just another type of imaging for high-risk women or women with really dense breast tissue. And we also have breast MRI. So there are some ladies who qualify to do an annual mammogram along with one of those other imaging modalities annually as well.
Okay. And of course, again, first timer, how would I even go about scheduling one? Is this something I need to talk to my own doctor?
Yeah, it's a very easy process at Unity Point. If you have a primary care provider through Unity Point and you have the Unity Point patient online portal, you can just get an order from your doctor, and then we actually have access to where you can log onto your portal and self-schedule now. If you don't have a primary care provider and you don't have an order, you can actually call Women's Imaging at Unity Point and just do a self-referral and say, hey, I'm 40. I don't have a doctor, but I want to schedule a mammogram, and that's something that they can do for you even without a doctor's order.
Okay.
You're just not able to schedule online if you don't have a doctor's order through the portal.
Okay.
And then we also have funding through our foundation at Unity Point that helps even patients with no insurance. So that way we're making sure we're reaching out to everybody in the community and making mammograms available to everyone.
Perfect. I love that. And when it comes to actually the location for mammograms, is there one here in Muscatine?
Yeah, Muscatine has an imaging center here, so certainly you can get those if you're here locally. And then of course we're based broader in the Quad Cities through Unity Point. We have imaging at our Moline and our Bettendorf campuses as well, and then here in Muscatine.
Perfect. And I mean, with mammograms and like the self-checks are a great defense, with fighting off, the potentials of having breast cancer. What are some other kind of tips to reduce the risk and potential of having it?
Yeah, it kind of goes back to the basics for reducing your risk for many cancers. So basic lifestyle changes like maintaining a healthy weight, limiting your alcohol use, no smoking, healthy diets, trying to avoid maybe carbohydrates and lots of sugar. Those are kind of the basic things. As far as breast cancer specifically, there's hormonal factors that can go into place. So postmenopausal women may be trying to avoid prolonged use of like hormone therapy and such. Women that have children, if you breastfeed, that's a small factor that can go into decreasing your risk for breast cancer. Also, going back to our high-risk clinic, we can kind of evaluate certain women that if they have a really strong family history and a high breast cancer risk, there's a small population of women that even qualify to take preventative medicine to help reduce their risk for breast cancer.
Okay.
So those are all things to kind of discuss with your primary care provider, maybe a referral to our breast center to talk about those options a little bit further. At the end of the day, you can do all those things and still get breast cancer, but they're just small little factors that go into play to help reduce the ladies' risk.
By following up with just kind of all of the healthy habits and develop those, staying consistent with them. So say that you do have a high-risk patient that has a family, basically tree of it.
Yeah.
Is their mindset already in the sense of like, well, my mom had it, my grandma has it, I guess I'm going to get it? Or do you kind of help
Many
control?
people feel that way, which is why we do the high-risk screening. You know, a lot of times we tell ladies we can't necessarily keep you from getting breast cancer, but majority of breast cancer are very treatable, curable, survivable disease, and that all goes back to early detection. So if we know that you're at this higher risk population and we're doing these more increased screenings, chances are we're going to find a breast cancer and it's going to be very small and early stage, and once again maybe kind of a bump in the road for ladies, but something that they're going to get through, and it's not going to be hopefully a huge lifestyle change for them based off of that.
Okay.
Yeah.
And I mean, even with the importance of it, obviously, October is Breast Cancer Awareness Month, but this is something to think about year round.
Absolutely. Absolutely.
And, I know a bunch of people who are probably watching who are all of a sudden thinking, oh my gosh, I'm in my 40s.
Yeah.
What is that kind of calm down advice that you like to kind of provide them just to ease their minds?
Yeah. It all goes back to that early detection again. Unfortunately, we are seeing, for whatever reason, a younger population of women, in the past couple years getting breast cancer more frequently. And so it kind of all goes back to, yes, it can be a very scary thing, but these are treatable, curable diseases. So putting something off isn't going to make it go away. It's only going to make it worse and harder to treat. So a lot of ladies too with breast cancer nowadays are candidates for smaller surgeries where they are able to keep their breasts and still go through their treatment and everything. So it's a big misconception that everybody with breast cancer maybe has to have really big aggressive surgeries, and we actually, majority of our women don't have those big surgeries now. So just coming in and not being afraid to get checked out, because the earlier the better and the easier process it's going to be to treat their breast cancer.
Okay. So yeah, I mean, that's kind of that another stereotype. Oh, I have breast cancer, I'm going to have this big surgery now.
Right, correct.
And you were talking about, you've been noticing a higher increase on younger women. What is that kind of age range that?
I mean, we're seeing women in their mid-30s, late 30s, early 40s, a higher population of women in that age group. For some reason, it used to be very few and far between when we would see those younger women, and now we are seeing more like that, whether it's better earlier detection. I mean, who knows? It's kind of too early to say. There's not studies out trying to figure out exactly why we're seeing this larger amount of young women, but we are. So once again, it's a misconception for ladies to say, well, I'm 41, I'm young, I'm healthy, I have no family history, I'm not going to have breast cancer. And we are, for whatever reason, seeing ladies with no family history that are young and healthy and just coming in sometimes for their very first mammogram at the age of 40 and then being diagnosed with a breast cancer from that.
Wow. So this is the type of cancer that it could just happen to any female.
Absolutely.
You could be in the best shape of your life.
Absolutely.
And still have a potential of something so small, seeing it and taking care of it right away.
Correct. I mean, the statistics are 1 in 8 women get breast cancer. So I always kind of say if you've got a group of friends that you've been friends with for a while and you get together for lunch once a month, chances are at least one of you in that group are going to have breast cancer. So it's a high number. It's one of the most common types, so that's probably not changing anytime soon. So all we can do is get out and find it sooner and cure all these women with these breast cancers.
Okay. And of course, like you're just maybe for some people that are just tuning in right now, just kind of let them know again how they can set up an appointment to get this started.
Yeah, so as far as mammograms, once again, you can contact your primary care provider if they're through Unity Point. You don't even have to make a phone call. You can log on to your portal if you have access to that, schedule your mammograms, cancel or reschedule, whatever you need to do through the patient portal. But also if they don't have let's say they haven't gone to the doctor in years, but they're thinking they need a mammogram, they can just call the Women's Imaging at Unity Point and do a self-referral for a mammogram and get it taken care of that way. And also to help with patients who say, oh, I don't have insurance right now, or I'm in between jobs or whatever, and they're delaying their care. We can help assist with funds for ladies that don't have insurance to make sure that nobody's falling through the cracks for that screening.
Okay. I didn't even know that there was a women's imaging too.
Yes, yeah. So we have a breast center basically based out of our Moline campus for Unity Point, but of course it goes across. We work together with all of our Unity Point campuses, but our main breast center, and that's where our high-risk clinic is kind of based out of too. So once again, going back to ladies that are identified that might be necessary to have a referral to our high-risk clinic to talk about their family history, to help identify if they need more intense screening, different types of screening and imaging. We also do genetic testing for hereditary cancer genes, so to see if ladies are candidates for that testing, and maybe we find out they have a gene mutation, even putting them at higher risk. So those are all things that we can take care of in our breast center.
Oh, that's awesome. Yeah, I had no idea that that was even a department?
Yep.
I guess? Yeah. Okay. We'll say department.
Yeah.
So to kind of end off, is there any additional information you just really want to make sure that women are aware of and kind of soak in?
Yeah. I think the biggest thing is just going back to not delaying things. I mean, we've even seen things on the Today Show lately, you know, with one of their co-hosts that was just diagnosed with breast cancer, and she said she had delayed her mammogram by 6 months, you know, and had this new breast cancer that had come about. And COVID has been a big thing for people delaying types of screening, and it's just knowing that unfortunately nobody is free from getting breast cancer, whether you're at average risk or high risk. We just can't put off these screenings and really hone in on how important it is to just do these things and keep up to date with them in order to make this a very survivable, treatable disease.
So self-checks, mammograms, and then even just going in for annual check-ins, just the importance of them. It's so easy to put that appointment off because it's only once a year.
Correct.
But that 40 minutes, like you said, could completely change your life.
Absolutely.
And just being ahead and being prepared for it.
Yeah.
Perfect. Well, thank you so much for coming on and talking about this. And I think this is always very important to address to people, like you said, 1 in 8 women, and it could be, you know, a group of your friends at a table.
Yep, definitely.
And that support system is going to be there, developing healthy habits, being consistent with them, and get your mammograms and your self-checks in.
Yes.
Perfect. Well, thank you again so much.
Yeah, thank you.
And safe travels, and hopefully stay warm this week.
Yes.
Fingers crossed. I'm ready for warm weather again. That'd be great. Do you remember that trick-or-treating here in Muscatine is going to be at 5:30 p.m. So I will remind you again, tune in tomorrow. I have good old Tony Tone, the OG host, and I will also have Lieutenant Macy from Salvation Army with me as well. So until then, stay happy and stay healthy. I will see you later, Muscatine.